Peace be upon you. Welcome to the What Does Science Say channel. Today, we are going to be talking about something that, can sound a little scary. Thyroid nodules. Just hearing the word lump or nodule can be pretty concerning, but our goal here is to really cut through the noise and give you clear, straightforward information. So let's dive right in.
Okay, so first things first, let's get some perspective. Thyroid nodules are, they're incredibly common. Seriously, if you're over the age of 50, there's basically a 50-50 shot you have one right now, and you might not even know it. So if a doctor recently told you that you have one, just know you are in very, very good company.
So what in the world is a thyroid nodule anyway? Put simply, it's just a little growth of cells inside your thyroid gland. You can kind of think of it like a small clump you might find in pancake batter. It's made of the same stuff, it's just clumped together. And they can be solid or filled with fluid like a cyst, or even a little bit of both. What's really interesting is that most of the time they're found completely by accident when you're getting a scan for something totally different.
All right, so for our first section, let's get into what actually causes these super common lumps and some of the risk factors that might be involved.
There are a bunch of different things that can play a role in nodules forming. Just getting older is a big one. So is inflammation, especially from autoimmune conditions like Hashimoto's. Things like nutrient deficiencies, past exposure to radiation, they can also be factors. But what's really important to get here is that in almost all cases, it's not because of something you did or didn't do.
So let's say a nodule has been found. What happens next? Well, we're going to walk through the diagnostic process. Doctors have a really clear, methodical plan to figure out exactly what's going on so it's not just guesswork.
Generally, the whole process breaks down into these 4 key steps. It always starts with a good old-fashioned physical exam and a chat about your medical history. After that comes blood work to check your thyroid hormones, TSH, T3, and T4, just to see how the gland is functioning. Then comes the really critical step, the ultrasound. And only then, if the ultrasound shows something suspicious, might a fine needle biopsy be on the table.
And there's a reason the ultrasound is called the gold standard. It's hands down the best way to get a look at the nodule. It's totally safe, uses no radiation, and it lets doctors see all the important details, like its size, what the borders look like, and if there are any tiny little calcium spots, which they call microcalcifications. All of that gives them really important clues.
All right, so the tests are in. Now for the big question. What does it all mean? Let's talk about interpreting the results, because this next slide, this is probably the most important thing to take away from our entire discussion today. So here it is. This is the big, reassuring news. The overwhelming, vast majority of all thyroid nodules, we're talking about 95% of them, are benign. That means they are not cancer. So while it's absolutely right to get every nodule checked out, the odds are heavily stacked in favor of it being completely harmless.
Now, if a biopsy does happen, pathologists use a grading system called the Bethesda system to classify the results. Just think of it like a common language they all use to communicate how risky a nodule might be. As you can see, a Category 2 is benign, which is fantastic news. A Category 6 is malignant, meaning it's almost certainly cancer. Everything in between just represents different levels of uncertainty.
So, what happens if you land in one of those gray areas, like a Category 3 or 4? Well, it doesn't automatically mean you're heading for surgery. Not at all. We have other options now. Sometimes it's best to just wait and watch. Maybe repeat the biopsy later. Or there's even advanced molecular testing, where they can actually check the nodule's DNA for specific markers linked to cancer.
Okay, that brings us right to the different treatment paths. And I've got more good news for you. For most people, the path forward is actually really simple and often doesn't require much intervention at all.
Let's say your nodule is confirmed to be benign, and it isn't bothering you. It's not making it hard to swallow or breathe. In that case, the standard of care is basically watchful waiting. Yep, that's it. No treatment needed, just a follow-up ultrasound every now and then to make sure it's not growing significantly.
But what if a benign nodule is big enough to cause problems?
Well, then you've got a couple of main options.
The traditional path has always been surgery, but now there's a much newer, minimally invasive option called radiofrequency ablation, or RFA. Instead of cutting the nodule out, RFA uses a tiny heated probe to basically shrink it from the inside, which means it preserves your thyroid and, hey, leaves no scar.
And what about that small 5% chance that a nodule is malignant? In that case, surgery is the main form of treatment. But here's something really important to remember. The prognosis for most types of thyroid cancer is excellent. It's one of the most treatable cancers out there and usually doesn't impact a person's lifespan.
Okay, last but not least, let's touch on some natural and lifestyle approaches. Now, getting a proper medical workup is absolutely number one. You can't skip that. But some of these strategies might help support your overall thyroid health. And of course, a quick disclaimer, always talk to your doctor before you make big changes to your diet or start taking new supplements.
A huge piece of the puzzle here is often reducing inflammation in the body. That usually starts with cutting back on processed foods, and for some people, things like gluten and dairy can be triggers. On the flip side, you want to add in nutrient-dense foods, leafy greens, things rich in selenium like a couple of Brazil nuts, zinc from seeds, and those great anti-inflammatory omega-3s you get from fish or flax.
On top of diet, there are a few key supplements and herbs that often come up in conversation. Selenium, zinc, and vitamin D are all super important for healthy thyroid function. And there was even a fascinating study that showed a combination of powerful anti-inflammatories, spirulina, turmeric, and boswellia, actually helps shrink nodules in some people over just 3 months.
And all of this brings us to our final thought. You know, getting a thyroid nodule diagnosis doesn't mean you just sit back and wait. The real key takeaway here is just how powerful it is to be informed. When you understand the steps, when you know the real statistics, when you see all the options available, you shift from a place of worry to a place of empowerment. So, the question we'll leave you with is this: how can you be an active partner in your own thyroid health? Thank you for being with us until the end of this video. Please be sure to subscribe to the What Does Science Shade channel and give us energy with your likes and comments. Share your comments with us and send the video to your loved ones so that others can also use it.